If you're trying to conceive and you're wondering if you might have PCOS, let me tell you about one patient that I recently diagnosed with PCOS. So I had a patient that came in to see me who was 33 years old, and she was having a period about every 45 days, and she wanted to know if she had PCOS. So I did an ultrasound, and she had polycystic appearing ovaries on ultrasound, and I also did some blood work. And her blood work showed that she had an elevated testosterone level at about 65 and an elevated AMH. It was like 15. So PCOS is a diagnosis made based on clinical criteria. There are three, and you only need two out of the three. One is having irregular cycles or not ovulating. The second is having polycystic appearing ovaries on ultrasound or an elevated AMH. And the third is having elevated male hormones, either in symptoms you're having like increased hair growth or in blood work like a testosterone. And this woman actually had all three with 45-day cycles, polycystic appearing ovaries, and elevated testosterone. But I was not done there. You also have to rule out other disorders that can act like PCOS but are not. So in her blood work, I ruled out adrenal disorders, thyroid disorders, prolactin issues, and then metabolic disorders like diabetes. And when all those came back negative, then she met criteria and I diagnosed her with PCOS. So PCOS is not just one lab test or an ultrasound or just a symptom you're having. It is a series of tests that we do and an evaluation of your history. So if you feel like you have irregular cycles or symptoms of PCOS, you should go get checked by your doctor. I'm Dr. Amy Brown, and that's your daily dose.